What are the risk factors for colorectal cancer or large bowel cancer? Essentially, 1 in 5 of these cancers, 20%, is because of familial or hereditary cause, and 80% are because of sporadic cause, meaning that the genes are not there or you don't have a family or personal history of a cancer. These are called sporadic. So that forms about 80% of all large bowel cancers. Now the 20% that is formed by hereditary and familial. By hereditary we mean that you are born with the genes. That happens in about 10 to 12% of large bowel cancers. And there are two conditions here, the familial adenomatous polyposis and the second is hereditary non-polyposis colon cancer. So these two are hereditary, you are born with these genes, occurs in about 10 to 12% of patients. The other is the familial variety, which means that you either have a personal history of a cancer in the past, it could be breast, ovarian, endometrial, or even a chronic cancer. Second is that someone first degree family member has had a colorectal cancer in their history. And the third is that you have a precancerous condition in your colon like multiple polyps, which you have undergone an endoscopy and a removal previously, but now it puts you at a higher risk of subsequent colon cancer. Let us look at the sporadic cancers. So sporadic cancers are essentially due to our lifestyle factors, and this is very important because this forms 80% of all our colorectal cancers. The first and most important thing is inflammatory bowel syndrome, IBS, and this includes ulcerative colitis, Crohn's disease, and a variety of others. So these people are at a higher risk of getting colorectal cancer. They need regular surveillance of their colon and their rectum. The others are essentially lifestyle related factors, and I will just mention to you in this regard the EPIC study, which was a study of 3.5 lakh global volunteers, and they found that 5 healthy lifestyle factors could reduce your risk of colorectal cancer by 37% compared to those who had only one or none of these healthy lifestyle factors. So what are these? The first is a healthy diet. The second is physical activity. The third is no alcohol. The fourth is no tobacco. And the fifth is to maintain, and most important, a healthy weight and not have obesity. So your risk factors are clearly related to this. It is obesity, physical activity, alcohol, tobacco, ultra-processed foods, excess refined foods. All of these modify your gut microbiome and make you at an increased risk of getting colorectal cancer later in your life.